Good morning. On behalf of National Women's League of ROC Taiwan, I would like to extend our earnest welcome to all the participants from different NGOs, NPOs, academic institutions, hospitals, and social enterprises that are here in Mayling Hall, online from Taiwan, and overseas in the UN, in this UN NGO CSW69 Parallel Event on the subject that is essential of the caretaking industry in the coming decades in mid of 21st century, titled Application and Development of AI-Enabled Solutions in Caretaking Industry, organized by National Women's League of ROC Taiwan, co-organized with Zanta International Network of Health Promoting Hospitals and Social and Health Services, YWC of Taiwan, Girl Scouts of Taiwan, Chinese Women's Entrepreneur Association, and Chinese Elderly Long-Term Care Association. We, the members of National Women's League of ROC Taiwan, are grateful to all the co-organizers to join us for this meaningful event. Ladies and gentlemen, now may I present you the moderator of the forum, Ms. Yang Xinxin, ex-board member of Zanta International and former Taiwan representative of Agency France Presse. Ms. Yang.
Thank you, Nancy. Good morning, and welcome to our CSW69 virtual and in-person parallel event entitled Application and Development of AI-Enabled Solutions in Caretaking Industry. I'm Xinxin Yang, the moderator for today. I'm a member of Zanta International, which is one of the organizers. Today is our great pleasure to have 4 distinguished academics, professionals, and specialists to share with us their experiences, observations, research findings, and the programs they are undertaking, and their recommendations to issues relating to AI-enabled senior care in the aging society. They are Dr. Suti Cho, Chair of International Task Force on Health Promoting Hospitals and Age-Friendly Healthcare. We also have Professor Peilun Rao, Professor at the Department of Industrial Engineering of Tsinghua University. Professor Rao is also Vice Dean of the Global Innovation Exchange. And we have Peishan Yang, who is social work professor at National Taiwan University. Professor Yang is also a founding board member of Jubo Health. And we have Sabine Lin, who is researcher of Foundation for Women's Rights Promotion and Development. Professor Rao and Professor Yang will speak to us from Japan, where they are attending an international conference. I believe we will all be inspired, motivated, and empowered after today's program. Now, dear speakers and participants, may I present to you today's keynote speaker, Dr. Joanna Lei, Chairwoman of National Women's League, which organizes today's event. Dr. Lei is a dynamic woman leader in Taiwan with career accomplishments stretching from education, media and communications, finance and business investments, and public affairs. Dr. Lei is also an articulate commentator on major domestic and global events. She is also a China watcher. Now, please join me in welcoming Dr. Lei.
Thank you, Xinxin, for that wonderful introduction. Good morning, ladies and gentlemen, and friends here and abroad online. As we started embarking in this journey of organizing an NGO CSW69 event, which was about September last year, we picked this topic. Little did we know there would be DeepSeek and all these other developments in AI, and recently, more advancement in incorporating AI technology with all kinds of healthcare, long-term care possibilities are blazoned and presented in front of everyone. So I guess we have a little foresight, and that allowed us to be one of the most interesting topics of this year's NGO CSW69. Let me do a little bit about the lay of the land, because there are a lot of discussions about technical developments, medical applications, but we're trying to look at how this new world can enhance well-being of everyone, and that would involve the roles of government, enterprises, MBO, NGOs, and social enterprises, so that the development will eventually be a tool to deliver better care, imagine better society for all of us, as we are aging as well. So let me start from my question. I prompted my AI and asked them to give me a picture of a typical perception of elderly in long-term care. And this is the picture it drew us. And that is not a picture we'd like to see when we grow old. There are three common misperceptions. Families should take care of their own elders. Long-term care is only for the very old and frail, and aging means losing independence and quality of life. And this picture probably presents the combination of that three misperceptions. But with all these promises that we're seeing now, we'd like to ask, AI promises, is this what you have in mind? Let me try to play this. So is the AI promise merely an Internet of Things, adding A and M in the equation? Is it an AI connected world of AI of medical things? This is oftentimes the way we see it. But let's go back a little bit about the development of AI in long-term care. It actually started from the automation and a lot of development in digital era for the healthcare industry. And primarily, there are 3 or 4 major things. Initially, it started giving administrative support, making scheduling and health delivery management system easier for the people who are in the healthcare industry. Then it gradually involved diagnostic and analytic co-pilots, reducing the time of analysis or determination and giving greater accuracy to reduce risk. Then gradually, as we move further, you can see some development in smart monitoring and real-time insights, including robotics and natural language processing. NLP is a very big step forward. And smart monitoring devices, which give people and feedback of the real-time insights. Lastly, to me, is one of the most exciting things. It's used on companionship. A lot of the patients or elder senior citizens had little ability to communicate their own situation. Oops, it keeps moving down. Had little ability to communicate their ability, especially with professionals rendering care. So interactive, generative AI increased the social and communication functions and companionship for a lot to go forward. So these are developments from the healthcare perspective. Later on, you have a lot more development in AI and potentially some applications in long-term care. And these are probably in progress and not all have been fully applied. 4 major ones, I picked most important and salient ones. Machine learning and predictive analytic, using algorithm to analyze patient data, using AI-powered fall detection system, and anticipate reduce fall-related injuries. And these are things that with machine learning and predictive analytics enhance the ability for us to render those. Then computer vision and robotics, the robotic caregivers, especially the ones with some kind of a human form, can assist with mobility, hygiene, and companionship. Facial recognition ensures and enhances the understanding to give general and personalized cares simultaneously and to enhance security. Then the development in natural language processing, NLP, and chatbots give people a sense of having some kind of a companion. If you have a box in your home, you probably have already been talking and chatting with your box. And imagine in the future, it take probably a human form, will have more personable communication. It also enables voice-activated communication for people to command the environment and get medical needs when necessary. Last one is IoMT, and I want to add A in front. IoT, everybody understands, stands for Internet of Things. But if you put A in front, is AI of medical things. So we are looking at smart sensors, wearables. They can track vital signs, activity levels, and medication adherences. And those wearable devices also provides continuous health monitor and communication, even in remote area. But I will do a little bit about this last point later on. So let's imagine the world. Applications of AI in long-term care can be illustrated in 3 major arenas. It's for at-home, in-home-based care. My AI also drew this picture for me. I wanted an AI-assisted at-home living. And lo and behold, initially the picture coming out was all machines around this elderly lady. But as you can see, it's not the purpose of having people staying at home and monitored in medical sense. It is to have assisted living, let that person receive quality care and even timely communication with the help of AI. So there are 3 major things that could be used. Remote patient monitoring, integrate wearables, because we have a lot of wearables. How many of you have wearables? Like your watch, monitoring your heartbeat and every aspects. A lot of them do. But what do you do with the wearables? You're supposed to upload it to a cloud. Few people do that. So the wearables is analytic and tracking tools with the AI assistance, even at home, those remote patient monitoring can be linked up. Second is voice assistants. Amazon has Alexa, Google has other assistants. If you look at China's a lot of boxes, they have very cute names. They provide you reminders, enable hands-free communications. The reminders can also be a timely tracking of your medication need and your other needs. We have a corn soup presentation later in today's session, and people can see other developments in that area. Then telehealth and AI triage is critical in optimizing the time difference when emergency happens. They can reduce unnecessary hospital visits, but they can also give you very timely diagnostic if necessary. My second question is to say, okay, imagine a world when AI is in assisted living and nursing homes. And that's my picture coming back. Of course, this is through many training and revisions. Initially, it was quite a gloomy picture too. Let's think about AI and putting it in a long-term care facility. In assisted living and nursing homes, automated medication dispensers can prevent dosage errors and enhance medication adherence. I often forgot whether I have taken my medicine or not. And with the AI tracking multiple people within a large environment, you can reduce those errors and do timely reminders. Then it's more than that. It's AI-driven health monitoring system analytics. Patient data and early disease detections in a group living or assisted living environment, you have multiple people, very massive number of data with the AI moving around can help you track each and individuals and provide timely reminders. Then the third and fourth ones are interesting. Let's think about social robots, Parallel and Pepper. It will go to you and say, oh, good morning, how are you today? Or they'll say, I think you need some more exercise. And then you can have a very lively chat. When the manpower within the facility, the real assistance, time and energy could be limited. You can have another interesting tools. Chen Mama in front of us once introduced a little robot about this big and to our National Women's League. And it sat on the table and started engaging in a lot of activities, even physical activities with you. And Taiwan has great development in those robotics. The last one is coaching and social functions, teaching you how to dance, working with you in exercises. All of this can be a help for the next topic. For the AI worker, AI can be a workforce support, can be a help to those people delivering those care, help to caregivers. So AI in the workforce, it's not only potentially taking over a lot of daily chores and common activities, giving you timely feedback, but it helps the people, the caregivers. And that is a critical point because of some discussions about whether AI will replace our jobs. No, it will not. It will make your job easier if we deliver and develop to the direction we want to. So AI in workforce has just a couple of examples: AI-powered scheduling system, clinical decision support system, and automated documentation all reduce the workload of the caregivers, releasing them to the interaction within their facilities or in the home environments. So both for senior citizen living alone, for the assisted living or nursing home, or to the industry, the caregivers, AI's promise is not just AI of medical things. It is to imagine a different relationship and different caretaking. So this is my next question. It's the most shocking one that I got. I asked them, okay, give me a picture of human-centered care with AI-enabled solution. 就是以人为核心的 AI 协助的解决方案. Okay, this is the picture. Is that shocking to you as well? The robot is sitting on the bed with a human giving it care. Okay, this is the shocking perspective, but it is not impossible. If we don't interject the people-centered philosophy and look carefully into what they call AI human, and sometimes they're just calling AI people intervention in their development. If we don't have a philosophy and the end goal to deliver well-being at the end, it will be most likely a picture like this. Okay, from that horrible, shocking picture, if we were to do something in the development, the most critical thing to me is to putting people back in the center of the AI development. Artificial intelligence and people intelligence. We are the center. And to do that, there are 4 pillars that we must pay attention to. First, has to be people-centric, centered around people, not technology-centric. 2, care, not treatment. We're looking at care, not just medical or other kind of treatment. Then the third one is equally important. We have to put family and community-based activities and support mechanisms back into the system, not putting people in an isolated or not putting robots in an isolated environment. We have to have family and community-based activities and support mechanism. And this is what Mayling has been promoting, and I will speak to that a little bit later on. Fourth is to give dignity and respect to the senior citizens. So we need to revisit what in our perception elder means, what care means. We need to have a new way of looking at the world and how to achieve that. I think our current development in technology is leaps and bounds. In business models, it's going forward, but the policy concerns remain largely unaddressed. And that's why I have a lot of chaotic lines in between these 2 boxes. Technological feasibilities always have to be funneled by social desirabilities, what we want as a society with policy. And finally, will have to be sustained by economic sustainability, meaning that those business models will make them, perpetuate them going forward for more people for generations to come. So from technology to social to economic, there is a very major funneling effect that happens. And that is why it's important to put people back in the center at this point. Technology development is a lot. And today we have Rao Pei to feature exoskeletons, and you will hear very exciting presentation from him, and he's currently in Japan. We also have newly developed mental health assistance tools to give personalized cognitive therapies. We have more enhanced data security and data management systems to provide protection in privacy. And then a lot of new business models testing AI-human collaborations. And these are happening as we speak. And we have quite a lot of businesses doing different kinds of experiments. But the policy concerns are plenty. So let me just iterate them one by one. Data privacy and security, your data, daily, timely feedback, real time, they need to be protected. Family and relationship needs to be put back and supported. Affordability and accessibility is a key to any universal idea to deliver well-being. And then there is an intrinsic gap in AI literacy, in digital divide, the ones who knows how to use it to the ones who do not know how to use it. You need human interface to help them bridge that gap. And also, let's not forget, all the computation and the major development has intrinsic biases. So the AI biases and ethical concerns needs to be addressed in our development. And I believe Qiu Shuti and our last speaker will address those aspects. And finally, what is the boundaries between AI, especially if they take robotic forms and looking more and more like real people, and us? AI human boundaries. And here I put quotation because I really hate to call us humans. Now, let me say a little bit about going forward. The last page was about what we need to address at this point. And then let's just move us and lift us up a little bit higher to dream a better future. So if we were to deliver universal care, anytime there's a new technology, it's always a promise to disseminate information, education, health services to people who are otherwise in remote location or under-resourced location can also be joined. So let's look at some of the barriers: availability, accessibility, affordability, quality of care in different locations. You all know different locations have different care possibilities, and ease of use and communications, to name just a few. So I added a few sort of hopes and dreams in our future. For example, the development in AI-powered mobile health unit can be given or driven to very remote locations. With AI-equipped vans and drones, they can deliver essential services to under-resourced locations and regions. And the portable diagnostic tools can minimize the mistakes or time delayed without a full-fledged hospital nearby. We can also imagine a world with AI support to low-resource healthcare facilities and locations. You have a lot of outposts in different places. 有一些卫生所或是其他的类似的很远的地方的那些 outposts. Those are often manned with one or two individuals with little support of their work. Once you have an AI link and communication link, they can be provided, these individuals in those outposts can be provided with automated triage systems, helping them prioritize their patients based on severity, giving them additional ability to diagnose and find out what's necessary for that particular situation. AI can assist healthcare workers with limited training in remote clinics, so they can be brought into the same level, at least same level of knowledge with their colleagues in other places. Then we can also imagine a world with digital healthcare accessibility and AI-based health literacy with the design integral to the overall system. AI-driven language translation tool to me is very exciting. I remember being in the United States, going to the hospital for the first time, and not having the ability to fully describe what my situation was. And I was a graduate student. So there were a lot of people who didn't have the ability to really communicate. But imagine now you can use your own language, and the natural language tools can either translate for you or even do a better communication on your behalf to the professionals who needed those very precise information to deliver health care or other long-term support. So language translation tool breaks the communication barriers. And chatbots and AI-driven apps can educate population about preventive healthcare and medicines. I worked as a scholar. We went to different countries, about 17 different countries, teaching people health control, AIDS awareness, AIDS prevention, and so on and so forth. And those can be used with very interactive tools in the AI world. AI facilitates mental health support, which was not before available. It is only with the natural language processing and generative AI that you can start imagining a mental health support system in AI. So let me give you my next quest to my AI and their rendering. With the three major developments above, the last one is now we can imagine a world with applications for remote and under-resourced location. Imagine you live in a village and you have a little cute AI and they say, oh, good morning, Mrs. Wang. Let me check your wearables and I'm gonna upload your information and give you your advices. Or it can just on the location. And I saw a demo of a cute little robot and it was in a Chinese rural site. And it was saying, oh, you know, how you doing? Oh, maybe you should use some of the Chinese herbal medicine. And they prescribes the Chinese herbal medicine to that little old man. That was one of the possibilities. Remote diagnostics, telemedicine, AI-enabled wearable and monitoring now can be uploaded and connected for managing your own health and your well-being. AI for long-term care and chronic disease management, including checking your medication and reminding you of when you needed to go and seek professional medical help. And it also can be used for mental health support, and that's only with the natural language capabilities that we're seeing the possibility. Now, also, should there be disasters, emergency situations. Remote locations are often isolated. So the other picture on this side is it provides emergency delivery with new tools such as drones and others, so that in emergency response, in drug delivery, in supply chain management, they can also be a very big help. And last but not least is for remote training, or real-time communication and decision support. So universal care has a very large barrier towards the last mile, just like when we look into the digital world. The last mile was the most difficult one. Trunks are easy. Medical centers are easy. Sending people to a center for care is our current solution. But what about the belief in well-being? We're not just looking at illness, we're looking at health. And that needs your regular daily treatment, daily management. And AI resolve one of the issues of lack of human resources. We cannot dispatch so many trained people to hundreds and thousands of villages in remote locations. But what if you put a really, really cute robot and they actually chat with you? Isn't that a possibility? It will happen if we look at developing that kind of a system. It won't happen if we don't have that philosophy in mind, that putting people back in the center, looking at care and not just illness. So let me do a quick conclusion, and this is by far a conclusion of where we should go, but a quick conclusion of the thing I just outlined earlier. It takes caretaking industry, elderly community, and senior citizenship, these three elements working together to develop new business and caregiving models with AI promises, AI as a promise, not as a center of our development. For the caretaking industry, we need to develop sustainable business model with different kinds of imagination of what our interaction with AI should be. I'm using the picture on the left to describe a model that's currently in exercise and in experiment. It's a technology company. They developed platforms. Then they connected hospitals and professional societies with human in their dispatching systems. They send assistants. You know, now time we have helpers sent to the homes. In our healthcare systems, we have relief workers sent to the homes. 我们有很多的家服员 to deliver home care. But in that system, the home caregivers are trained to use their monitors. When they go to the home, they help upload the data and then download the potential advices and help the elderly or senior citizen to what they need to do. So if you look at this caregiver on the left, it is what we envision, an AI-empowered caregiver connected with the business model of caregiving industry. And they connect with the medical and other health providers to create a vertical link from top to bottom. So that's one of the models that I saw was, I thought was very exciting. Then we need to also reimagine elderly community. And I was corrected. I forgot to correct this. The community was mostly people my age or older, because I have a 敬老卡嘛, so I'm officially an elder person in Taiwan. We need to look at a new way of imagining our life. Yueling has been promoting the third family, which is the one on the right-hand side. You create your own community. The first family is where you're born into. The second family is where you have children and you take care of others. But as people gradually age, you need to create your own community with families, friends, support systems, with people around you. And now we call it the third family, and lots of people and lots of places are actually promoting that idea. Build your own network so that your community is not alone, but is supported by AI. I put a little AI on top. So when you get together, you can have education, social functions. You can check each other's vital signs, check your wearables, and do a lot of things together with the assistance of AI, not centered around AI. Last but not least is looking at what senior citizenship is really about. We have to capitalize on this new technology and new capability to enhance active living through skill enhancement, like I cannot draw, but now I have all the pictures showing you. Through skill enhancements, workplace adaptation, physical therapy, training, community engagement and volunteering, and so on and so forth. All in all, it helps senior citizens to stay engaged at home, in workplace, and with society. So this is what I mean. From the initial gloomy picture of what senior citizens look like in a society, and oftentimes we'll look at that and look at those people as problem to solve. So we need to build systems supporting them, delivering medication to them. They were seen as something that we need to collectively resolve and solve. But what if we imagine a new way of life to extend the period of your active activities, active participation in society, active contribution to other generations? So the first man is like me. I was working on my computer, trying to generate all these pictures for today. And these are new skills that I never had. And if I weren't doing this presentation, I probably wouldn't have. The second one is, looking at the exoskeleton tools, a healthy senior can help others through volunteer work. And the third one is a senior woman can impart her wisdom to others. So, ladies and gentlemen, I think we need to reimagine what the golden age is about. It is not a problem to solve, but assets for the entire society and hopefully globally to capitalize. There were a lot of things that we need to work. We need to have standards established, development path built by smart entrepreneurs. But to us, NPO, NGOs, and other people who care about our collective future, we are also a stakeholder in this process. And that is why we organize today's function, and hopefully that will shed some light into our discussion going forward. Thank you so much.
Thank you, Dr. Lei, for giving us such an insightful overview on the healthcare and caregiving sectors, and telling us prospects for the enhancement of active aging through AI devices with human factors and the promotion of third family. I'm also learning this skill. Bear with me, please. Okay. Here we are. My dear friends, may I present to you our first speaker for today. Oh, sorry. The wrong one. Okay. Okay. Thank God. Now, my dear friends, may I present to you our first speaker for today, Dr. Shu-Ti Cho. Dr. Cho is a globally recognized expert in evidence-based public health. She developed the largest network of health-promoting hospitals and the first age-friendly healthcare recognition program in the world. Our topic today is AI-enabled community-based health service system towards healthy aging for all. Now let's welcome Dr. Chiu. It's supposed to. Okay.
Thank you, Moderator Yang, for your kind introduction. And dear the Honorable Chairperson Lei and honorable guests, ladies and gentlemen, and dear colleagues, I'm Professor Shuti Cho. It is my greatest honor and pleasure to attend this session to share with you some progresses in this field of age-friendly healthcare. At the same time, you can see how challenging my job would be to speak after Chairperson Lai. She brought us the very rich, very dynamic, high-tech, yet also high-touch presentation, which is very fruitful and educational. But I think at the same time, with her very fruitful content, it also made my job easier. And I will mention that, as you have heard from Chairperson previously, and when you hear anything that she and I both mentioned, it's easy to tell that those elements might be very important in today's topic. So I'm going to talk about AI-enabled, community-based health service system towards healthy aging for all. And I will briefly introduce what is the ideal health service system which can bring us towards healthy aging, not just for you and me, but for everyone. That's very important. And then how is AI enabling such a system? And then I will conclude with challenges and the perspective forward. So what is the ideal health service system towards healthy aging for all? According to UN's Decade of Healthy Aging 2021 to 2030, which was approved by the UN General Assembly in 2020, the vision is a world in which all people, everyone, can live long and healthy lives and to leave no one behind. And in its plan of action, there are 4 areas for action. And among the 4 areas, I'm going to focus my talk on the third and fourth one. The third is to deliver person-centered, integrated care and primary health services responsive to other people. So it's not going to build larger and larger medical centers. It's the person-centered, integrated care and primary health services that's helpful for healthy aging for all. And also, it's important to provide access to long-term care for older persons who need it. And the first and second one is to combat ageism and to foster enabling community environments. But I will not mention those 2. As I mentioned, it will be the third and the fourth areas. And UN provides recommendations to foster the development in the third and the fourth areas. And by summarizing the UN recommendations, here today, the community-based health services system we will refer to is the age-friendly primary care, long-term care, and assistive technologies in the communities where older persons live. And this system has the following missions. First, it must provide high accessibility, and also high quality and high efficiency. And it must be person-centered, and it must be well integrated, coordinated, and it must provide continuous care. And it also has to address prevention, health promotion, and disease management, including self-management. And it also has to support health workforce and informal caregivers. So how is AI enabling such a system? Obviously, the current system is not working in that way. So how is AI enabling us to have such a system? I will introduce on 4 dimensions of development. First is to strengthen the capacity of community-based primary care and long-term care facilities. They are not the big hospitals with many machines and many subspecialists. So if we are going to have an ideal system in the communities, we must strengthen the capacity of such care units. And second, we have to improve accessibility and integration. And third, AI is helping to improve the efficiency. How is it doing? And fourth, how does AI support patients to improve their chronic disease management, their safety and well-being? So in the first dimension, I will talk about here diagnostics and disease identification by the primary care units. For example, medical imaging. AI enables quick and accurate interpretation of such images, even though there is no radiologist there in the primary care clinics or in the long-term care facilities. Yet, by the support of AI, for example, mammography screening. With screening, it means we have to do it to all the women aged 44, 45 and above. So there's a huge amount of images, but AI can support us to do the very quick first-hand interpretation. And also for sonography. For mammography, we need to have good sensitivity. For sonography, for example, for thyroid gland, that's the other issue which currently we are bothered with too many false positive results. So we would like AI to assist us in specificity. And very honorably that in Taiwan, we have the company which developed such AI tool to reduce false positive results. And our national health insurance has planned to pay for such tool to support the frontline clinicians to avoid unnecessary false alarms and unnecessary medical wasting. And then we also have AI-assisted EKG. You can use that in the long-term care facilities. When the patient has some emergency situation, you can have a quick assistance. And then for diabetes patients, they need fundus screening and detection to avoid blindness. And this has to be done to every diabetic patient. And again, currently AI has such a tool to help us. So in the US, Food Drug and Agency, they already listed more than 1,000 such products, and 3/4 are the development in radiology, and 1/10 is in cardiovascular health. For example, the detection of arrhythmia. And regarding the second thing in the first part is the clinical decision support. And according to this very recent scoping review, it looked at artificial intelligence-based clinical decision support system in primary care. How is it helping the primary care physicians? And it shows that 3 among 5 studies showed that it's effective in enhancing diagnosis, treatment, and adherence to guidelines. So our primary care physicians can make the treatment plan according to guidelines. This will greatly improve quality of care in the primary care level. And it also helps physicians inform their patient better. And it also help coordinate care and reduce time for chart reviewing. And regarding support for prevention and health promotion, AI helps us in doing fertility risk assessment and full risk assessment. And also it helps remind cancer screening. So who are the patients we should arrange for cancer screening? And they can also help scheduling and the communication with those patients who should do the screening. And then regarding accessibility and integration, I will not go into details. You know that telehealth, telemedicine currently are widely adopted, especially after the pandemic. And actually in Taiwan, our national health system is promoting hospital at homes, which means to treat pneumonia or urinary tract infection without hospitalizing the patients. We can treat them at home or at the long-term care facilities. But with AI-assisted telemonitoring, we can do it more in a safer manner. And then regarding improving efficiency, actually, AI can support clinical documentation and child records. So save a lot of time for frontline people. And it also can support resource optimization in long-term care facilities, such as to optimize staffing, resource allocation, and workflow in long-term care facilities to improve efficiency and patient outcomes. And also it can support revenue cycle management and supply chain optimization, although with more complex job that AI may support us. We also need to be cautious about more pitfalls behind the screen. And then in the patient's side, AI can support patients to improve chronic disease management, safety, and well-being. I think you are very familiar with that. For example, AI-driven medication management to remind the patients to take their pills on time and with correct dosage, and then blood pressure, blood sugar monitoring for arrhythmia, chatbot for emotional support, and also currently, because our evidence show that these can improve cognitive function, so that there are developments in AI for cognitive training and rehabilitation, for example. And then the challenges. And the way forward. About the market, the healthcare AI market is expected to grow 1.5-fold per year. So within 10 years, there might be 40 times growth in market. And the current leading market is in North America, but Asia Pacific regions such as China and India, the markets are rapidly growing too. However, we will hope that in addition to be person-centered, we also would like the AI to develop in the manner which match our needs, and also to develop based on currently available evidence and to generate evidence further. And also, it's very important not only to have this development for people who you are working at the front line. You are asking, are we adopting them, and how are we going to adopt them? It's very important. If they are not adopted, they will not create any help or impact. And so, for example, this issue of the Lancet Digital Health, which is the #1 journal in medical informatics, to celebrate World Women's Day, they pick up the theme about how will AI accelerate gender equality in health. And they published one paper regarding promotion of mammography. Breast cancer is the leading cancer in women. And also it published the paper about AI-enabled EKG for sex-related CV cardiovascular risk assessment. So because for older women, actual cardiovascular risk is something, especially after menopause, but that is something very often neglected. And our risk is a little bit different from males. So you see, it's very important that we look at the major issues and we look at it with a gender sensitive way. And for healthy aging, for example, there are key domains of intrinsic capacity about our function. So vitality, mobility, mental well-being, cognitive capacity, hearing, and visual capacity, these are the important areas. And for preventing disabilities, for example, I've mentioned cancer, cardiovascular health, these are non-communicable diseases. And also prevention of falls is also very important. And for health promotion, physical activity, nutrition, and oral health, these are the very important areas. So we hope AI development there's a brain to direct where should we go to and how are we going to help people. And then for evidence-based development, for example, for fall prevention, fall risk assessment, AI is doing a good job. Fall prevention is multidimensional. So in addition, for persons, individuals, it's important to have gait and balance training. And then environments are important. We need to do home-based assessment and modification. And then we need pay attention to medical system about medications. So it's a multifactorial intervention. However, in the AI development, forensic assessment is doing pretty well. But then there are a lot of efforts for detection, thousands of publications. And then in a recent article reviewing on what to do for fall prevention, it focuses on individuals, not on, it neglects environmental aspect. And no wonder that in a recent review for the World Guidelines for fall prevention, in this aspect of technology, it says that current evidence does not support wearable devices for fall prevention. So you can see, but why didn't they also look at AI? Perhaps because at that time the ChatGPT was not born yet, but currently we can also apply AI to help us. What's the currently available evidence to have a quick view so that we won't go the wrong way? Okay, then how to improve adoption? Here are these factors. We can see that trust is very important. The accuracy, the experience and the openness of AI tool is very important to build trust. And also internal factors such as ease and efficiency of use, such as ability to complement clinical judgment, and external factor, which Chairperson Lei mentioned, privacy and liability, and the finances, and the technology infrastructure. These are important. And what I mentioned, impact and evidence-based, that's the outcome. Anticipated impact on our patient care, our patients, on the provider, to reduce provider burnout, to improve patient and provider relationship. These are all important. And this is the recent review just published in this issue of the bulletin of World Health Organization. It looked at how frontline people perceive as important to improve adoption. And the results just echo the previous slide I gave you. So, and it should be gender sensitive and age and culture are sensitive. And currently, perhaps within 5 years, AI is not just the tools to use them, but also it can become automatic and work in a proactive and system-based way so that AI becomes our teammates. So we call it agentic AI development. This is just published last month in Lancet, the #1 journal in medicine. And so it says that it might be able to proactively monitor our data and identify issues and to propose solutions for us. And it can track patients' conditions over time. And then it also can help us orchestrate various AI tools to improve our performance. And so in conclusion, application of AI carries high potential for improving our community-based health service system and to accelerate a healthy aging for all. But we need to develop it in a more organized, system-based way so that AI development is needs-based, is evidence-based, and it's gender, age, and culture sensitive. And we also need to accelerate frontline adoption, which will rely on better performance of AI system, transparency, trustworthiness, but also the government support, policy support on the digital infrastructure and also the financing structure. Thank you for your attention.
Thank you very much, Professor Cho, for introducing how AI development is enabling community-based healthcare system. Dr. Cho also points out the AI advancement must be based on needs and evidence to achieve effectiveness and create impact in the path promoting healthy aging for all. Thank you. Our next speaker is Peilun Rao, engineering professor at Tsinghua University. Professor Rao focuses his research work on human-computer interaction, intelligence interaction, cross-cultural studies, and well-being design. Professor Rao will speak to us from Japan on the theme application of AI in elderly care, research and innovation in human factors engineering. Now, Professor Rao, the floor is yours.
Thank you very much. Please allow me to share my slides. Yeah, I'd like to share my slides. All right. Thank you very much. It is indeed my pleasure to speak in a special session with so many distinguished speakers. And I feel excited, and I have learned a lot from the previous two talks by Dr. Lei and Professor Cho. I'm very energetic. I'm and they're very excitable. I really enjoy them. Now it's my turn to talk about application of artificial intelligence in elderly care. And my background is human factors engineering. I work with Tsinghua University, but not the one at Tsinghua, the other one. I can introduce my research area a little bit, and I'm more than happy to hear Dr. Lin mention human-centered design or human-centered AI. This is a key word. In our area, we call it human-computer interaction, and you see we have human in front of computer, right? So in this picture, it kind of illustrates our idea. On the left side, you see human. And through interaction, through interface, we work, we collaborate, we communicate with machines. And AI either supports the interaction or embedded in a machine to understand human better, to support human. And human-centered design is not just a concept, it's a way, it's approach, methodology. So in the development process, in the development life cycle, we proactively, we actively get users involved. And in this case, we're talking about older users, older people. Here's a little introduction for the aging situation in mainland China. I think you could see, like many other developed countries, the speed of aging is very rapid, and pretty soon the proportion, the percentage of older people is getting high, is pretty high. And so there are also a lot of AI applications in elderly care here and there. 3 examples. First one, like smart monitoring and early warning. So we could use an AI-powered health monitoring system to analyze ECG data for older people. And in the case published, it says it could successfully provide early warning for a lot of potential cardiac actions. And AI can also support health management. And there's a senior care facility implemented this AI-driven personalized nutrition plans, and that results in a 40% improvement in overall nutrition portion. And also daily support, living assistance like robots. Yes, that's the first keyword I would like to talk today. And what are the robots for? Particularly for supporting walking. We all know the risk of falls or muscle weakness or joint stiffness, impaired balance, and so on and so forth can really influence the quality of lives. And even some chronic conditions can hinder mobility. Mobility is really important for anyone, also for older people's quality of life. And potentially more problems like loneliness or social isolation can be associated. So after decades of development, as you remember, when I saw the development of exoskeleton robots in Japan, I was very surprised. 20 years ago, or even earlier, the development of AI was limited, but the robots already, exoskeleton robots already developed as one kind of assistive technology. Right now, with the development of AI and other new technologies, exoskeleton robots, we believe, can help older people overcome walking challenges and also reduce fall risks. And with AI, these devices, these robots can be customized to individual needs, ensuring much better, comfortable, healthy walking experience. And you probably have heard about Elon Musk is working on brain-computer interaction. what about using your brand, using my brand to interact with robots, with exoskeleton robots? This combination could be a interesting thing, new technology, new innovation to help more older people. Let me give you what AI technologies can support, can advance exoskeleton robots. First of all, AI can continuously analyze user state. Do you have a smartwatch? If you have an Apple Watch or any smartwatch or smart bracelet, they can measure your gait, like how many steps you walk, right? And even your heart rate, and all this can be included as exoskeleton robots. Excuse me, I think there's an audience with your microphone on. The one using the Huawei device, excuse me, can you maybe notice, stay muted? Thank you very much. And the second advantage of AI technology for exoskeleton robots is personalized adaptation. AI personalizes the exoskeleton settings based on the user's body and behaviors. And also predictive maintenance. AI monitors the exoskeleton's performance and even can predict potential failures, and also maintenance. By the way, I'd like to introduce a concept for you to understand this exoskeleton robots better. It's like vehicles. Vehicles like, all right, motorcycles, like cars, bus, trucks. So if you are thinking about these robots, particularly exoskeleton robots, technology-wise, these machines have motors, battery, meaning power, some gears, and computers or computing devices, chipset, of course, and sensors. So the machines, technology is pretty much like those vehicles. First of all, in terms of, say, cost and price. And secondly, with the support of AI, don't forget, these devices can be connected to the internet, wireless internet. So a lot of data can be stored, collected, analyzed locally or remotely. All right, I haven't finished. There are 3 more advantages with the application of AI for exoskeleton robots. There will be increased strength and endurance. AI can adjust the exoskeleton's strength, and also collecting data, which is talking about those devices can be connected for sure. And with that data, with machine learning algorithms, AI can continuously adapt to the user's movement patterns. All right, enough of talking. Take a look. Again, think about an idea of vehicles. So cheaper ones could be like 2-wheel motorcycles, or more expensive one like 4-wheel, like say sedan, like a car. And there could be some very expensive vehicles, right? But there could be some vehicles much cheaper for certain situation or satisfy certain needs. So here you see different kinds of exoskeleton robots. So some can support regular or typical users. Some can even support people with special needs. I think in the field, you don't have to be an expert. You don't have to be a physician, neither any medical expert to see how this technology can help. And again, not just exoskeleton robots with the support of artificial intelligence. On the left, it was before the 15 sessions of rehab. On the right, you see, even without this exoskeleton robot, this gentleman can walk by himself. I think if you were there witnessing, seeing people can do that, and even seeing the tears, the laughs on the face of the user and the user's family, I'm pretty sure you'll be touched. I did several times. And again, like vehicles, there are different kinds. You don't have to have a very big one, very expensive ones. There are light ones, there are simple ones. And also check the left case. The left lady, the lady works all right, you see. You can see a lot of people actually working around us, they're doing all right. But with this exoskeleton robot, it can be better. Why not? All right, and again, this machine, it's not like expensive, it's not like complicated. Is it right? The lighter one does not need many motors. It needs a smaller battery, less gears, and less sensors. But of course, the most important thing is AI. AI should be there. Supporting and data should be collected to support patient, family, and also physicians or any caregivers. And I talked about brain-computer interaction. Yes, on the left, you see examples. AI can help caregivers and can also help the users. Before the development of artificial intelligence, we used to do a lot of programming. We have to use with coding. Otherwise, the robots will not move as we want. But right now, with development of artificial intelligence, you can just move the robot. On a lower left video, you can see the caregiver can just move the robot, and then the robot could learn what to do and help the user. And on the right is the testing video clip. You can see someone using his brain to control, at least jointly, to control the exoskeleton robot. It's like playing a game, right? Not really. Not just the only thing Elon Musk is doing. Many companies, many people are working on this. I'll give you a further example. That's plus. That gets three things together. You play games. You play, you do. You're using your smartphone, tablet, computer, or game console, like PlayStation, like Nintendo Switch. If you do use game console, I think you do know these physical games. So you can play tennis, not in a tennis court at your home, all right? Oh, I forgot to mention Microsoft Connect. You can do a lot of things. So here in this video, make it louder. You can see a chronic stroke patient wearing the exoskeleton robot with the brain-computer interaction function and playing a serious game. All right, so the patient couldn't really walk very well, need to recover, and need to go through a lot of rehab, treatment, a lot of things. And you know, it's a good idea to play a game, right? And gamification is one way also to help the user, help the caregivers to make the rehab, to make the everything more interesting, at least to do this way. And at the same time, don't forget, the robot can still record the data, analyze the data, personalize for the user, and also providing analysis to medical caregivers and also their families. So again, three things together, serious game, okay? Exoskeleton robot, yes, and brain-computer interaction, using your brain to control the device. Three things together. And this is not in a lab. You may wonder, hey, how come I cannot see the video clip very well? It is in a hospital. It is around us. It is not something very, very, very advanced. It is advanced, advanced for sure. But pretty soon, you can see this around us. All right, if you think the robot is too much, let's forget about those machines, those hardware. That's, think about the difference in like smart devices. Okay, this is a research collaboration with a Japanese company, Hitachi, you may know, to work on a brain health device. So the concept, the idea is no longer like vehicles, it's just like a smart device, like your smartphone, like your pad or laptop or any smart device with some sensors fixed on the head band near your forehead. This device can collect data based on functional near-infrared spectroscopy and for the user's brain health. So how can AI support, first of all, data monitoring? Similar idea, right? It can do a real-time brain monitoring, monitoring of the blood oxygen level changes before people need to go to lab, go to hospital, and with a lot of sensors and machines and gather readings is not so easy for the users and neither for the physicians. But in this case, we're thinking, hey, can we have some simple device? And again, personalized intervention. All the data can be analyzed and personalized for the user. And for the user, not just recording an observation, for progress tracking and treatment and assessment. And I can show you what we did. We did some user testing. One important thing of human-centered design, human-centered technology is, again, actively involving users through the development life cycle. So we are pretty common. We have users to do some tests. We test the machines. We ask users, we invite users together with us to test the machine. We're not testing the users. And so in this case, our users can try this device and doing some simple tasks using the brain, again, brain-computer interaction, using the brain to control, to monitor, and then the performance will be provided as feedback to the user. This is what you can see on the left side. So thinking about if you could have a little, again, it's a new smart device linked to your smartphone or your any other smart device and doing some little exercise. I'm not talking about physical exercise. I'm talking about cognitive exercises. To be honest, I think sometimes I think I do need that. Sometimes for relaxation, sometimes for stay focused. But anyway, it's kind of an exercise. And we're also doing this. We're thinking, yeah, we can also use this device linked to a robot. So this is the now robot we have in our lab. So we can use the robot to interact with users at the same time, giving the feedback, not just on the smart devices, giving the feedback to our users, so that we believe the users will be happy or feeling easier to use such a product or to get the information feedback. The last one isn't really our research. It is a little case I find out. It could be the last case for my talk, meaning if all the devices, robots, new technologies are too much for you, this could be one simple case, just based on large language model. In this case, Microsoft or Asia Research Institute, they have this personalized cognitive training. They call it framework because it can be further developed as a smart application. Or do you use social media? You use social media to talk to people, to interact with friends and families, right? What if there's an agent or if there's a robot chatbot interacting with you on your social media, which is Line, Instagram, Facebook, so on and so forth, and ask you to do some little things. It's like a daily conversation, but the purpose is to support our cognitive functions, or even, again, it's like a cognitive exercise in little training. What about that? And the agent or the conversation can be, there's one way to interact on the social media can be easier. You don't even need to download an application. You can just just do it. Coming back to the case. So this case is little framework saying, all right, just do some little cognitive training and forget about robots. You don't need new devices. You can just download an app or start a new conversation with a chatbot and try to recall, try to memorize something interesting. For example, like I'm in Japan. Hey, if I ask you, hey, what about your last trip in Japan? How do you feel? Right? That sounds like a daily conversation, but it's actually could be some informal cognitive training based on the development of large language model. And I have another case, a little case not showing here. It's a application supporting mental health using generative AI based on the drawing function of AI. If someone doesn't feel so good, we could ask the person, hey, just draw your motion, just draw something. But what if, like me, I don't do very good drawing. I say I can't really express myself by drawing. But right now with generative AI, I can talk. I talk, AI draws, and somehow I can express myself. I can somehow talk to myself with the help of generative AI, drawing. What about that? So this is just like a simple application, not just hardware, with the support of the newly developed artificial intelligence. There are a lot of things we can do. All right, I think I'm running out of the time. I think finally, I'd like to conclude my introduction of all cases. I'm thinking maybe I should change the sentence. The original one is AI will enhance and empower an aging society. And I'm thinking maybe we should say AI is enhancing and empowering our aging society. Again, it's my pleasure to share my research and experience, and you're more than welcome to give me any feedback. And again, thank you very much for listening.
Thank you, Professor Rao, for sharing with us how AI and robotics can be applied in elderly care. The two representative cases, exoskeleton robots and brain health monitors, are very impressive and informative. Thank you. Our next speaker is Professor Peishan Yang. She will talk to us from Japan. Professor Yang is from the Social Work Department of National Taiwan University. She specializes in gerontology social work, community resources management, and aging and technology. Her presentation is entitled, Taiwan Can Help in Health and Care Industries, the Examples of Corn Soup Platform. Her assistants will help with the technical side. Thank you.
Thank you. Can you hear me?
Yes, please.
Okay.
Yes.
Thank you, Moderator Yang. And ladies and gentlemen, I'm Pei Shan from National Taiwan University, Department of Social Work. I'm also here today presenting to you from Fukuoka, Japan. Fukuoka is an active aging and dementia-friendly model city, so I'm very happy to make my presentation today at Fukuoka. It is really a great pleasure to present here today at UN NGO Forum. I received my MSW and a PhD in social work at Columbia University and spent about 10 years of my life in New York, studying and working as a certified social worker at a Jewish home and hospital, currently the Jewish Home Life Care. I had gone to UN Square many times back then, and today I'm presenting online. In 1997, I started teaching at NTU Social Work and providing consultancy to the central and the local governments, as well as various NGOs serving the seniors and their caregivers. So I have great confidence today to share with you Taiwan experiences in health and care industries, while we are facing a great future of technology and the AI era. Can you see my PowerPoint?
Yo.
Okay. Eunice, please follow, okay? My title today is Taiwan Can Help in Health and the Care Industries. I will use the example of Corn Soup Platform. Next, please. The health and the care industries are one of the world's largest and the fastest growing industries, consuming over 10% of gross domestic product, GDP, of most developed nations. Taking the United States as an example, healthcare is the largest sector in the American economy. Please do make a note. It is not the computer or the car industries, but the healthcare industries. It represents about 17.3% of GDP, and health employs more workers than any other sector, including manufacturing. In 2022, Americans spent $4.5 trillion on healthcare. Next, please. Then we talk about healthcare in Taiwan. A national healthcare insurance system, NHI, was introduced in Taiwan in 1995, exactly 30 years ago. So we have quite a lot of experiences with an universal healthcare insurance system. NHI plus tax plus private spending equals to about 10% of Taiwan GDP. The Taiwanese healthcare system is characterized by good accessibility, comprehensive population coverage, short waiting times, low cost, and big data for policy practice and research, which has been proven to be highly valuable in today's AI era. Next. Policies and practice are best developed based on solid theories. In Taiwan, we have been applying the theory of active aging for long. And we can see the photo of active aging by WHO. Next. Active aging was announced by WHO in 2002. It promotes maximizing opportunities for older adults in health, social participation, and security. UN suggests that all nations should apply active aging as a key policy framework. And we can see there are 3 columns. Next. There are also many key determinants of active aging as shown in the picture. Besides personal, behavioral, social, economic, and environmental factors, health and the social services are key determinants to active aging. In addition, culture and the gender are crucial to the construction of a society conducive to active aging. So we can see gender and the culture surrounding all the other key determinants. Next, please. Since 1970s, when personal computers emerged, human history has entered the digital age. Human lifestyles have been transformed by the internet, technology and the devices, social media, big data, automation, and AI. The digital age has reshaped economies, societies, and cultures, creating new opportunities, challenges, and global connections, like I'm presenting here to you in Japan. Telemedicine and the e-health platforms have made healthcare more accessible to people in remote or underserved areas, improving healthcare outcomes and addressing disparities and inequality. Next, please. In 2019, my colleague, Professor Lin Shanru, also at the NTU Department of Library and Information Science. Shanru and I have published an international journal article titled Digital Aging as an Essential Component of Active Aging. We use the method of literature review to distill three major components of digital aging, namely senior information literacy skills, ICT knowledge, and supportive networks and services. That was also the first time academics used the term digital aging, and we developed the term. Next, please. It is important to explore how individuals achieve active aging in information society. Next, please see the picture. We also have 3 columns, right? Next. One major strategy of the health and the care industries is to promote active aging through gerent technology. Gerent technology combines gerontology, which is the field of knowledge related to seniors or senior living, and the technology. Gerent technology tackles issues related to all the ambitions and the needs of older people in their environment and the aging process itself. Next, please. Goals of gerontology include, but not limited to, independence, better quality of life, supportive environment, such as human architecture, equipment, and services, useful and user-friendly products and services at reasonable costs. In order to achieve the goal of reasonable costs, that is, affordability, we must upgrade availability and scale. That's the function coming in with all the private producers. It means that we need more and the bigger service and product providers, producers and providers in the global health and the care market. And Taiwan cannot miss the market. Next. Let's see some applications in gerent technology and the related industries, such as sports and fitness, healthcare, housing, employment and work. We sometimes call workplace adaptability, mobility and transportation. Previous speakers have used the term assistive technology, information and communication, etc., etc. Besides individual devices, more important is how to build integrated application platforms and systems, or the so-called supply chains. And we all know that is the strength of Taiwan suppliers, because Taiwan is a small country and we have very closely knit networks. Next, please. Taiwan has been hosting many major business exhibitions in recent years. Please see some photos taken at the 2024 Taipei Care Expo. Such major exhibitions are very influential for good business returns. And of course, it was also a lot of fun for us. We see many, many friends locally and internationally. Next, please. Now I'm going to introduce to you Dynalab, the founder and the CEO of Dynalab, President Fisher Lee. I hope he has joined us today. Is Fisher online?
Yes.
Okay, can you please wave to us?
Hello.
And I'm gonna say a few words first. Since 1987, Dynalab has successfully served Taiwan and Japanese markets with Dynafund products. 就是我们大家都有用过的华康自行。Since 2001, Dynalab started to provide corn soup service platform, now welcomed by Japan, Denmark, Finland, Germany, and other developing markets. Dynalab works with many partners to make the world safer and happier. Fisher always says that the happiness of people has been his primary concern while he invents the platform of corn soup. Next, I'm going to invite Fisher to explain to you what corn soup is. Fisher, please take the floor.
Thank you, Dr. Yang. I'm very happy to be here to present you our new disruptive innovation called corn soup. The reason we call it corn soup because I'm always hungry, like Steve. The picture here shows an elderly lady watch our corn soup through a big panel, and through this big panel, we can integrate multiple services to the TV. I'm now in Yamaguchi-ken, working with one of the largest retail stores here. We plan to support the senior citizen from government and the private sectors. Next, please. This chart shows that a user using corn soup could get the service from multiple dimensions, including food, clothing, housing, transportation, healthcare, and many others. Next, please. So this picture shows that elderly people can dial their fixed line telephone. Then this telephone will turn on the elderly user's television. So without adding too much hardware at all, and no need to learn new way of using appliances. So the elderly people can use the telephone, then trigger the TV, turn into a service kiosk. So once they push the button on the remote controller, then one service provider will show up on the TV. Then after a couple of minutes chatting, he or she can invite the second one to show up on TV. So this picture shows it's a three-way conference call on TV today. I just signed a contract with Nagato City in Yamaguchi-ken. It's a very small town with only 30,000 people. I signed a contract with the mayor, and they are very happy and excited to try out this in Japan. Afternoon, I'm going to meet with their superior organization. They have 1.4 million users. So I believe working with our Professor Yang, we can extend our experience in Taiwan, then to Japan, from smaller city to large metropolitan. I am eager to learn from you. The last thing I want to say is our system could put AI engine into the server so the elderly people can dial and talk to the AI. The AI could show a graphic on TV. So perhaps Japan and Taiwan will become one of the most AI support country because of this infrastructure readiness. Thank you.
Thank you, Fisher, for your wonderful dedication and your great success in Japan.
Thank you.
And we hope to use the Corn Soup platforms very soon in Taiwan. And we can all
Yes.
make the life easier and happier for seniors. Thank you.
Thank you. Take care.
After his words, let us see a short video of Corn Soup so the audience can have a better understanding.
非常有限，双方声明依旧，各自表述。大陆外交部坚称，台湾问题是中方核心利益中的核心，是美中关系最不。平台已开启，专人丁安基提案1，影片播放提案2，因为无个人化认提案3，请根据全球输入案件。只在中西。拍者，不要再踩，我在忙了。
Thank you, Eunice. We can see from the videos, someone dials the telephone, the TV screen turns into the Corn Soup platform immediately. Next. On this page, there's a link to a longer video so you can have a better understanding. Due to the time limit, we regret that we are not going to play the video. Please, dear audience, please scan the QR code, then you may look at it later on your own. Okay? Next. Dynalab's most recent endeavors are to utilize personal health records data to tailor-make service plans for individual Corn Soup users. Remember, I mentioned that our national health insurance system has created over the past 30 years, huge data to make our own personal health plans. For example, a reminder to take medicine may pop up on the Corn Soup screen, and it won't disappear until the user finishes the medicine. But of course, all the data to be used individuals have to agree his or her data to be used. Okay, so we have to follow the privacy guidelines. Next, please. As Fisher mentioned, all the services on the Corn Soup platform will be enhanced by AI step by step. Next. Here comes my conclusion. We hope to show the world that Taiwan can help. While facing great challenges of the existing super age society, the public, private, and NGO NPO sectors in Taiwan have invested in various dimensions of the health and the care industries, and we have been working really, really hard. In the coming years, Taiwan will use our competitive advantages in technology, health, and the social care services and the health data to further enhance AI-enabled solutions, which will make huge contributions to the world. With that advancement, super age society will not just be a problem, but huge challenges and opportunities for us. With these words, I will end my presentation today. Thank you very much for your listening.
Thank you.
Thank you, Professor Yang, for explaining the terms active aging and gerund technology and introducing the Corn Soup platform, which offers services helping people achieve active aging through gerontechnology in this digital world. It is also our honor to have Mr. Fisher Lee, founder of the Dynalab, to talk to us on corn soup that he created. And congratulations to Mr. Lee for successfully introducing the corn soup to Japan. And we also thank the two assistants for helping us with the slides. Our next speaker is Sabine Lin, researcher at the Foundation for Women's Rights Promotion and Development. Sabine's research work involves integrating gender perspectives into online and digital marketing training to address the impact of digital technology on women's labor participation. She also focuses on exploring the relationship between technology and care work, particularly how digital health solutions and AI-assisted caregiving influence women's contribution and working conditions in the care sector. Now let's welcome Sabine Lin.
Which one? Okay, this one. Okay. Thank you. Thank you. Good day, everyone. My name is Sabine Lin, researcher of the Foundation for Women's Rights Promotion and Development. It's truly an honor to be invited to participate in this meaningful forums. First of all, allow me to briefly introduce our foundation. We are a foundation which is dedicated to advancing gender equality in Taiwan by acting as a bridge between the government and civil society. And at the same time, we also serve as a hub of resources and information, providing support for women's empowerment and development. Our foundation focuses on 3 key areas: to promote gender equality and women's empowerment. In policy advocacy, we bridge public and private sectors, advocating for policies that integrate gender considerations into decision-making. Through international cooperation, we engage in global networks, sharing resources and best practices to strengthen gender initiatives. In awareness and empowerment, we support grassroots organizations and disadvantaged women, providing skills and resources for a better future. Through these efforts, we strive to build a more inclusive and equitable society for all. Now, let's start with these 6 little icons. In the digital era, health technologies like telehealth, AI, IoT, cloud computing, big data, AR, and VR are transforming caregiving. As previous speakers mentioned, these tools enhance efficiency, decision-making, and care quality in both community and home settings. At the FWRPD, we have been long committed to promoting women's rights. With low birth rates and an aging population reshaping society, as you can see in this picture, one of our key concerns is how digital health advancements affect women who remain the majority of caregivers. With this in mind, I'm excited to share with you our project, Promoting Gender Equality and Inclusion in Digital Health Technology for Caregivers. Before I go into the details, I would like to highlight some key statistics that show why this topic is so critical. Please refer to the slide showing the International Labor Organization data pie chart. Globally, most paid and unpaid care work is performed by women. According to ILO, women undertake 80% of all unpaid care work in the Asia-Pacific region. Imagine that, 80% of unpaid care work is carried out by women. It's an overwhelming majority. And now, let's look at the formal care workforce. Women account for over 70% of the global health workforce, including those employed in care institutions. This means that whether in unpaid or paid capacities, women form the backbone of the caregiving sectors worldwide. Additionally, according to OECD data, 90% of the long-term care workforce in OECD countries is also made up of women. Here in Taiwan, this gender pattern of caregiving is also obvious. Women make up 60% of family caregivers in long-term care. More specifically, women form 84% of home care attendants for elderly care and 83% of nurses and nurses' aides in nursing homes. What do these numbers tell us? They show that women are the primary users of digital health technologies in caregiving. So are these innovations designed for their realities? Are they accessible? Are they inclusive? These are the questions our project seeks to address. To better understand these statistics, let me share a real-life example. So last month, I got a call from my old friend. She's a stay-at-home mom with 3 daughters. And now her youngest daughter started school, so she was finally thinking about, okay, it's my time to go back to work. But then her brother called. So their mom was showing signs of dementia, easily to forget things and making up some stories that doesn't exist. So without any discussion, her brother sent their mom to her, assuming she'll take care of it, just like every other time when their mother has health issues. So once again, her plans to return to workplace were put on hold. This isn't just her story, it's a reality for many women. We are often expected to take on the role of primary caregiver. And this is exactly what our project seeks to explore. And to achieve this, our project is guided by 3 key objectives. First, understand caregivers' needs and challenges in using digital health technologies. We want to hear directly from caregivers, both paid and unpaid, about their experiences. What are the obstacles they face? What support do they need? What will make these technologies truly useful for them? And second, to identify approaches to achieve gender equality and inclusion in digital health technologies for care work. It is not enough for technology to exist. It must be inclusive and equitable. And through this project, we aim to explore ways in which digital health solutions can be better tailored to the needs of female caregivers, ensuring that they are practical. And third, to suggest policies that improve caregivers' access to and use of digital technologies in their roles. Policymaking plays a crucial role in shaping the accessibility and effectiveness of digital health technologies. And our goal is to provide concrete research-based recommendations that can be inform future policies and initiatives. To gain a comprehensive understanding of these issues, we have conducted 2 consultation interviews in 2024. With 22 participants from 13 countries, including government officials, tech developers, caregivers, and scholars. Participants were invited to share their experiences and perspectives on care work, technology development, and policy frameworks. Our interviews reveal that digital health technologies are already used in caregiving, including online appointments, teleconsultation, patient monitoring, caregiver communities, service mapping, and scheduling tools. When designed well, these technologies help caregivers access information, analyze data, and build support networks, improving their well-being and quality of care. However, despite these benefits, several barriers also hinder caregivers' adoption of digital health technologies. First, many caregivers struggle with low digital literacies and skills. making it difficult for them to adopt new technologies and limiting their ability to benefit from digital health tools. And second, even when caregivers try to use these tools, their complexity and lack of design for caregivers create challenges. Without sufficient support, caregivers may feel discouraged and abandon these tools. Third, cost. Cost remains a significant barrier. Many digital health technologies are expensive and making them inaccessible to caregivers who have left full-time jobs to provide care. Without financial assistance or subsidies, these tools remain out of reach for many who need them most. And fourth, stable internet access is crucial for digital health tools, but caregivers in rural areas often struggle with limited connections, hindering access to teleconsultations or online resources. Finally, language barriers further hinder adoption. Many caregivers, particularly migrant workers, face problems when using technologies not available in their native language. Without multilingual support or localized interfaces, these tools remain difficult to use. These challenges highlight the intersectionality of caregiving. Factors such as gender, age, education level, economy status, geographic location, and cultural background all influence a caregiver's ability to use digital health technologies. Beyond these challenges, AI-assisted health technology can unintentionally reinforce gender biases and exclude certain groups. Several key issues have emerged. To begin with, medical diagnosis bias remains a significant concern, and AI algorithms often reflect existing biases in medical research. For example, the same symptom, such as heart palpitation, a feeling that the heartbeat is so fast, too far, or skipping a beat, may lead to a heart-related diagnosis for men, while for women, is more likely to be misread as anxiety. Another pressing issue is voice recognition and interface design. Many caregivers are migrant workers or non-native speakers of the dominant language, making it difficult for them to effectively use voice-operated health technologies. In addition, data bias in AI training creates a serious challenge. Many AI models are trained on biased data set, leading to misdiagnosis for underrepresented groups. For example, AI trained mainly on data from white male patients may struggle to diagnose conditions in women or people with darker skin, resulting in misdiagnosis and delays in treatment. Moreover, there's a lack of culturally appropriate solutions. AI-driven tools often overlook cultural differences in caregiving, such as the strong family involvement common in some cultures. These tools, designed for individual care, may not align with collective caregiving practices, making them less effective for communities that rely on family support. Last but not least, gender imbalance in technology development limits the inclusivity of digital health tools. The underrepresentation of women in AI and health tech development means that many digital solutions are created without fully considering the unique needs of female care workers. So, how can we increase caregivers' access to digital health technologies so that they truly reduce the care burden and enhance work efficiency? Participants proposed several key recommendations. To make digital health technologies more accessible and truly beneficial for caregivers, several key steps must be taken. One important approach is providing digital skill training. Governments and care institutions should provide training to boost caregivers' digital literacy, while technology companies must offer ongoing support to help them navigate digital systems effectively. A crucial step is ensuring inclusive technology introduction. When new tools are introduced in care environments, all caregivers should be properly onboarded with sessions that explain the tool's purpose, function, and data usage to ensure smooth adoption. Additionally, improving internet access is essential. Governments should invest in expanding infrastructure in underserved areas, while technology companies can develop offline features to ensure caregivers with limited connections can use digital health tools without interruption. Affordability is another key concern. Many caregivers struggle with the high costs of digital health tools. To address this, government should offer financial assistance programs and subsidies, ensuring that cost is not a barrier to access. Lastly, enhancing gender inclusivity in AI-assisted health technology is critical. This means recruiting more female developers to bring diverse perspectives, involving caregivers in the design process through co-design, and collecting data from various caregivers groups to ensure the solutions are accurate and fair for everyone. By carrying out these measures, we can ensure that digital health technology truly improves both caregivers' well-being and their ability to provide care effectively. And now, I would like to take a moment to share what we have been doing in Taiwan to address caregiving barriers and gender biases in digital health technologies. Since 2011, the Gender Equality Policy Guidelines have guided technological development in Taiwan, ensuring that gender perspectives are integrated into research and innovation, making technology both effective and equitable. Building on this, the White Paper on Science and Technology strengthens our commitment to gender equality by prioritizing inclusive technology and embedding gender considerations into research and innovation, supported by the National Science and Technology Council's guidelines for gendered innovation. Moreover, we recognize the importance of supporting female researchers. Many women face career breaks due to caregiving responsibilities, but through a dedicated program, we offer funding and incentives to help them re-enter the STEM field. By increasing women's participation in the sector, we ensure that diverse set of voices and experiences shape the future of digital health technologies. And finally, in 2023, the government approved the Action Plan for the Gender Technology Industry, a critical initiative that brings together various ministries to promote aging in the community and the development of people-centered gender technology. This plan not only focuses on digitalizing care facilities, but also integrates smart technology that aim to reduce the burden on caregivers and improve overall care efficiency. To conclude, our project highlights both opportunities and challenges of integrating digital health technologies into caregiving. While these tools can support caregivers, barriers such as digital literacy, cost, language, and gender biases must be addressed. By conducting inclusive policies, providing gender sensitivity training, and ensuring diverse perspectives in AI development, we can create a more equitable and inclusive caregiving environment. Through this forum, we aim to work toward a future where digital health technologies truly benefit not only female workers, but all caregivers, ultimately improving the well-being of all individuals in care. Thank you.
Thank you so much, Sabine, for identifying the top 6 technology trends reshaping healthcare and the digital health challenges in care sector, especially for women caretakers. Thank you.
Please just stay for a moment.
Okay.
On behalf of all the organizers, including our co-organizers, I'd like to thank you all for attending today's forum, but let us first thank our moderator, Yang Xinxin. Since we have so much to communicate, we're sort of running out of time, but We will stay and hope to continue to engage in conversations going forward. Let me quickly go through what we tried to communicate and achieve today, as well as some recommendations. In the overall forum, there were 4 major things that were being communicated by different speakers. I hope to use this as the takeaways as you end this session and go back to your daily work. Let us continue to focus on a people-centric approach. So the 4 major things that covered in today's forums are: 1, we need to develop AI with a people-centered approach with evidence-based research, and also with special attention paid to the intrinsic biases in age, in sex, in languages and cultures. Secondly, in order to bring everybody into this world, we have to have the ability to bridge the digital divide, the technology divide, and the AI divide. And hopefully some of the programs being communicated today show the efforts of making it an inclusive technology and empowering technology for all. And this requires very special coaching programs, dedicated resources, and different interaction platforms. Thirdly, huge policy challenges require international cooperation of those policy concerns. We urge governments and industry organizations, leaders in the industry, to address key concerns such as data privacy, data safety, security, as well as accessibility, affordability, with very clear guidelines. It is also imperative to establish comprehensive monitoring and oversight mechanisms to avoid abuses. Last but not least, let us resolve that we will strive for a universal care. This is a lofty goal enabled by developments of technology, and it allows us to continue to dream for a world when the golden age is truly the golden age. So while business communities are trying and developing different kinds of models, B2B, B2C, and even B2B2C, we urge governments, NPOs, NGOs, social enterprises to also come in to develop different kinds of ways in which to afford affordable and universal access to an AI-enabled products and services delivering to all world. Ladies and gentlemen, with this as a conclusion, but not as the end of our communication, let us continue to engage, discuss, and hopefully dream together. Thank you so much.